Hello everyone. This is Dan Lannon. Just saying hello. I'm gonna give people a minute to get settled, make sure that the audio is coming through clearly. Greg will give me the thumbs up if it's not. Dan Harrison won't be joining us today. He's engaged in another commitment right now. He might sign on later and update us if there's anything important from the commitment that he's on talking about right now. And so I just wanted to go over a few things that sort of how the weekend went for everybody, and talk about some specifics about the care center and the residential homes and number of cases we have, and talk about the staff and our continued strategy and executing that strategy. So thank you all for joining us. So, as this has ended up coming down, Tuesdays seem to be much more of a detail-oriented update of how the weekend went, number of cases that came down, staffing patterns, and so Sharon Pitts will be joining me in a little while, and she'll speak to some of the medical experiences she's had going through this with different boards of health. And Department of Public Health, and then I'll highlight sort of numbers of people that have tested positive and how we handled the weekend and what the plan is going forward. I'm happy to report right now that we have currently just 4 people at the center. We were waiting on some results for another 3 that had lived with someone who had tested positive, and we were waiting for their results, and their results certainly took a little longer than other results that we were getting from other people, but those people have come back negative and cleared, and so I'm happy to report that 2 of the 4 people living at the center today, 2 of the first cases will be moving out later today. We have had the residence for which they live at, and then the other 3 tested negative at. We have had it professionally cleaned and disinfected. That happened yesterday. We actually have another house being cleaned and disinfected as of today. And so just so people are aware, and I think it's an important detail, it's $4,000 the cost to NuPath is for each of these houses, but we just think it's a vital thing to have the environment cleaned as thoroughly as possible for the individuals and for the staff going back to the houses. So we have one of the houses, the first house where someone was diagnosed positive, everyone moving back to that house today, that house being completely healthy for now, hopefully going forward. And we just want to remind parents, because a couple of parents have reached out to us, like wondering if we're going to be able to get back to normal. We will try to get back to normal routine for that house, and people won't have to be isolated anymore or quarantined, but we still are at a stay-at-home order by the governor, and so we won't be able to be getting out and doing some of the activities that we're used to being able to do, unfortunately for that house and for everyone really, as we adhere to what the governor has requested. And so that only leaves 2 individuals at the center currently right now. Once those 2 move out, who have tested positive, and the house where one of them is coming from, we're actually getting cleaned today with the hopes to be able to have that person transition back out to his residence soon. And so we're addressing cleaning specifically a room of someone who is at another house who had tested positive, but we won't have that house fully cleaned as of yet. We're certainly doing a deep cleaning of the person's room and the environments, bathrooms, kitchens, every general common area, but to be able to have it to really do the degree that we did at the other 2 houses, we need the house vacated for a lengthy period of time, and we're not able to do that with for the residents in that house not showing signs or having test positive. So we will continue to do the deep cleans and the cleaning at New Boston Street. We have not moved in anybody to a room or area where somebody else has stayed yet until an area is deep cleaned, and we haven't had to do that because again, we're sort of in NuPath's flattening the curve. We're doing a good job with not being overwhelmed and just maintaining the cases as they come in and supports. And so with 2 individuals living at the center, we will still currently have that with nursing oversight and clinical oversight, and staffed at a 2 to 3 ratio at times, and 3 to 3 ratio during certain other times. And so we just think that that's a necessary support that will need at the care center. We overall, the feedback that we have gotten, that we've received, I should say, excuse me, from parents and from guardians and from funding source DDS and Department of Health and Board of Health and the City of Woburn has been very positive. They've been very supportive. We just continue to communicate our numbers of people at the center, what, the ones that have tested positive, and management of when someone's able to move back to their residence and get back to some semblance of normalcy. We certainly take from the Board of Health. And so, fortunately, hopefully, this is a little bit of a lull, and it allows us to sort of restock supplies and just make sure we're comfortable with all environments. We don't have anyone else in any other houses right now showing signs or going out to be tested, which is fantastic. We hope everyone remains healthy. We think that this really comes from us streamlining staff to work at that one specific residence where they had been working, so that we didn't have the cross staffing at different houses with greater chance of infecting other people. And so we think that has helped us control the numbers thus far. And so we're certainly knowing, or we're anticipating not being out of the woods yet. We haven't had to address some of our real medical fragile people in their houses. No staff or no individuals there have tested positive or showing signs. And so we're nervous about when it gets to those houses. Those houses aren't as young and healthy as some of the other houses where we have people living in. So we want to just stay vigilant with the cleaning there and staffing there. Staff have continued to be outstanding. We've had more and more people step up to volunteer at the care center, as well as work at the residential homes. Certainly, I think the incentive program that we were able to put out once we heard about the stimulus package signed by the president, and the CARES 3 package, which has allowed us to be able to make sure staff are being reimbursed, and that we're able to continue to commit to them staying at a hotel and keeping them safe. We know that everyone might have saw earlier today a notification from Dan Harrison to contact your congressman and legislator for a call to action, because there is a request to have what would be the 4th stimulus package to get us through this COVID-19 crisis, and calling on your legislators to act soon and put some of those supports in place, particularly for agencies like us who are being reimbursed at a lower level right now, or a lesser level, and also having to employ the same or if not more staff and be able to also have greater expenses coming in right now. So I've talked with a few family members. I haven't had the chance to reach out and talk to as many family members as I'd like, or have been able to keep up with as many emails that I like, but I can tell you that I've asked directors to reach out and contact you, or staff to reach out and contact you, and just make a connection and try to answer your questions that you had. I know a lot of them are just messages of support, and I truly appreciate that. I know the staff truly appreciate that. I think people have been outstanding, from families through the process of their son or daughter being testing positive, and the scariness that the center, I think, brought some families at first. I think we're starting to see the benefits of having enacted some of those early decisions, which we did, with the center, which we decided to seek approval to the concept of the center on the 16th of March. And again, that was our emergency plan, and luckily we received a lot of support from the local City of Woburn and the Board of Health, and really our funding source and everyone. And we Having been on a call earlier, or a couple of calls earlier today, as well as one is yesterday, I think that, in hindsight, has been a very positive strategy for us. It has been very costly as far as expense for staffing and for just overall supports, but I think for the individuals and for the safety of the staff, I think it has been the best case scenario going forward. We are treating this as a lull. I know there was a question come to me, what is next with only 2 individuals being at the center, but I think we're continuing to staff it and man it and supply it so that we are prepared, when that next round, if it comes through. So a lot of information there. I'll just recap some of the highlights. That actively there's 4 people at the center. 2 will be moving out today. That will leave 2 still staying at the center. The staffing pattern still remains pretty much the same. It'll be 2 to 3 ratio at times, sometimes 3 to 3 ratio with clinical and nursing oversight still. We are seeking guidance from the Board of Health when they feel it's okay to move somebody out after the 72 hours of not showing signs and the other duration that we've been asked to monitor. And so Sharon can speak to some of those specifics, but we're certainly, for anyone's approved to move out, we contact the Board of Health as well as their primary and get their guidance. And so, it's been a good approach for us. We feel comfortable with, the support that we've gotten and the feedback we've gotten and received from the Board of Health, and we will continue to execute that plan as we go forward. If our numbers start to increase, which, from everything the federal and state is saying, that, we're about to embark on a tough period of time right now over the next 7 to 10 days. And, we'll try to be as prepared as we can be, just like I told you last week, we were trying to be prepared as we can be, and we'll just continue to do that daily. And that is monitored, by a group of people who are doing this daily. The Sharon Pitts and her team of nurses, and Elder and his team, and Ted Hahn and James and Brian from New Boston Street and Westford and their teams, just reaching out, trying to get some of the telehealth checks in with our clients that don't live at our residential programs, just to make sure that they have what they need, make sure they have the technology that they need so that they're able to participate in these webinars, but also anticipate in the online programming that we got going on in classes and the Zoom meetings, and just some of the enrichment activities to just keep people engaged, because you do, I guess we are humans, so we all need that human interaction, and we want to be able to let them know that there will be, we will be here, and we will get back to some normalcy sometime soon, and we want to let them know that other people are with them and care for them, and we can provide that support if they need that at all. So I don't know, Sharon, Greg, maybe if you want to bring Sharon in. I do have 1 or 2 updates at the end. I'll update people on, and I know there was a few questions, so I'll try to read those as Sharon's talking, but maybe we can bring Sharon in and go from there. Sharon, you, my friend, are on. Sharon is at the Bedford location right now. I think she's probably only there by herself or with 1 or 2 other people, and she has been certainly bouncing around the community to the different residential programs, but I imagine your phone doesn't stay charged very long.
No, it doesn't. That's the issue.
Yes. So why don't you take it over, and I'll be here, when you want to kick it back to me, and I'll try to answer some of the questions and ask those later.
Okay, so I just wanted to go over probably just the process with the Board of Health. So we take our the information from the Board of Health. They are our number 1 person to go to in the direction that we take from them. So we have daily check-ins with the Board of Health, whichever Board of Health that each person, whatever house they live in, whatever town they live in, we connect with that Board of Health. I speak with them daily, and no one can leave coming out of isolation or quarantine until, even if the doctor says it's okay, Board of Health has to give their okay as well. And so the daily calls that we have, we get phone calls from the primary care physician's office is calling daily. The Board of Health calls daily. We are monitoring their vital signs and their oxygen saturation, just to ensure that they're not having any issues breathing or shortness of breath or anything like that. We've been very fortunate that the 4 people that tested positive have had mild symptoms, and that is just wonderful news. I think that you know, us closing our programs early, all the making sure that everything's being wiped down, everybody's wearing appropriate PPE, all the things, the social distancing, just following all the guidelines that, you know, we are held to has helped immensely. I know that the president and any news cast that you listen to right now talks about these are going to be the next 2 weeks are going to be the, you know, the hardest. And so we are, I feel, as an agency, we are very well prepared for that. And with our praying as well, we're hoping that this goes as smoothly as it has been so far. I do really want to thank the staff that are working and continue to work. I think that we have a wonderful team of people that are providing all the care and concern for all of our individuals. We have, I'll just tell you, the oversight, and we've had various phone calls with doctors, so that has gone well. We've the outreach from the day programs, calling into all the houses of the people that come to our day programs. That has gone well. That's bringing some issues to light, like supplies, whether people are running out of, say, pull-ups or in need of something else that an O2 SAP machine. Like we're here to hopefully help to get everybody through this situation. Those calls are going well, very much needed. And I don't know if anybody has any questions. Dan, maybe you want to take over?
Yeah, so
sorry, I was just going to jump in there quick. And Sharon, I know you already spoke to this, but a question came in from a parent. It was, how is it determined that those who were tested positive, removed from a house and are being moved back into their house are no longer able to pass COVID on to others?
Okay, so so the process for am I on?
yeah.
Yes. Okay, so the process right now, it's they're talking a 14-day quarantine. The Board of Health is taking the day of onset of symptoms. So say it was a temperature of 100.2 or 102 or 101 or whatever the date of that that first symptom. That is the date of the onset. They take that, and it's 7 days from that. And then 3 days from that, they have to be 3 days without any symptoms. And then Board of Health, believe me, I've had to give them all the readings, because when they're in that at New Boston Street, they're getting their temps taken and monitored every 2 hours. So I've had to actually give them all those readings going back, whatever, 8-10 days. They add, so it's taken very seriously when we can let someone out. Because of how we don't know if anybody can get it again. We're hoping that that's not the case, and that people have built up some antibodies or immunity to reinfecting. So we'll just continue to maintain when we go home, maintain our social distancing, maintain washing our hands frequently, maintain all the necessary things that are input to anybody's house, whether they've tested positive or not tested, or have had any symptoms or not had any symptoms. That's the bottom line.
So Sharon, yeah, so someone asked a similar question or emailed me a similar question today. And so I'll, just recapping what you said, what we've noticed is it's been at least 10 days. And when you total up the 7 days from the onset of symptoms to the 3 days of being temperature free. So a minimum of 10 days, could be as long as 14 days is what I had shared with a family member. But I think what I told them too, and what we've learned in this process, and what I've tried to communicate some of the other times is, I think different boards of health have treated it differently from one board of health to another board of health. And I think, working with the Board of Health and Department of Public Health, that, getting that answer, and then also then looping in that the primary is what you've done so much. Because we've always, I think they're taking the lead or suggestion from us, and just saying, that here is all the data we have, here is what we're seeing, we think that this person would be okay to go back, or we think that, that they're not showing any signs, and here's the data that shows it, and the house just got deep cleaned, and it seems like it'd be best to get them back. And I think, would that be the best way to describe it to a family member? Because that's the way I sort of described it earlier today, and it sounded like that's what you just said.
Sorry if that's not how it came out. Yes, that is exactly. We haven't had that yet, but we could come across someone that is positive, and it takes 14 days before they start showing symptoms, or certainly that may come a time, but right now we're going by what the Board of Health is saying, and their word is the word. Even if the doctor says they're okay, Board of Health still has to give the okay for that to happen. So.
Yeah. And I know that I was talking with another provider on a call earlier today, and the question came up where they tried to quarantine the specific house where they had their person first, test positive, and then they had staff move into that house and stay for 7 days with the individuals, and then go home, or stay for the 14 days with the individuals, and they counted that as part of their quarantine period. And I know that this particular agency, they didn't have the staff quarantine after that shift of 14 days. And I know that one provider was talking about how the Board of Health recommended that they had the staff quarantine for the 14 days. And so I think what we're learning on this process is that, if a staff's doctor, their primary, because they've been around somebody that has been diagnosed as positive with this, tells them to quarantine for 14 days, and they don't get tested, that they are getting cleared to come back to work, and that their next step might not be to go get tested themselves. That's what their primary is going to tell them, or work through. But we've seen it, and other providers have seen it, to where, after the 14 days of when a staff is quarantined, the doctors and the medical professionals are thinking that they're ready to go back to work. And so I don't know if that makes sense. I guess I was trying to answer two part there. I was trying to answer a staff's email who sent me an email earlier today about having completed the quarantine period, and they weren't sure if they were able to come back to work. And I told that staff I would check with their primary, but it is our understanding that they're clear to come back to work as long as they're not showing symptoms. And as you mentioned, we're still taking the temperatures of staff when they report to work. We're still monitoring that. We're still sharing that with the Department of Public Health. Our conversations and communications with family members at the residential programs, because we know how hard it is, not to be able to come in and see your son or daughter and interact with them. We've tried to do the pictures through Navigating Life, but we've also tried to continue to update them of this process, which has evolved now with the Board of Health and Department of Public Health, about, sort of what you highlighted. Here's the process. Here's what we do. Here's when we see the onset of signs. We've learned, Sharon has learned with her team to suggest or to, if someone needs to get tested, we know sites that we want to stay away from getting testing because they're using the state lab and it takes seven days for the state lab, where the private lab is taking, 3 days or soon 24-hour turnaround. And so we want, those are the sort of information we're sort of collecting and gathering so that we can get people tested as soon as possible and
Right.
able to get the person back to wellness as soon as possible. So
Yes. Well, they've changed the criteria for being tested many times now, and so in the beginning you had to have at least a temperature of 102 to be tested. So at the beginning, when this all started, they just wanted you to stay home and isolate the person in their room with the mask if they're ever out of the room, and monitor. And then those criteria kept changing. But we've had to, on our part, advocate for people to get tested because sometimes doctors don't want to listen to us about who needs to be tested or whatever. So we are strong advocates as well. It took us 4 phone calls for one particular person, 4 straight days, just to get someone tested that we thought should have been tested. So we are advocating for everyone that we are caring for.
Yeah, no, you certainly are. I know that, I know there's so much news and information out there, and people interpret information and become, I guess you would say, armchair doctors, or make they put on their doctor's hat and give a best recommendation of when they think, when a whole house should be tested after somebody living there should be tested, or all that staff should quarantine and all that. And so I can tell you on each of those cases, we're treating it as a case-by-case basis. I mentioned before, we've tried to have a whole house tested once one individual comes back and tests positive. It's my opinion, not being a medical professional, but that's still the best, that's our first best step, and we will continue to try to do that continuously. We are not getting we're not getting that support from the Board of Health at this time, or Department of Public Health, and so we've asked DDS if they could assist us in that. But we do think that would be the best scenario, or I feel that, and we asked that question, if we can have the rest of the house tested right away. And then as Sharon said, it's reaching out 4 times for one particular person who lived with someone who had tested positive, who was showing signs, who had a temperature, and it still took 3 or 4 days and constant contact from Sharon Pitts and her team to try to get that person tested. So,
and I'll just add a little on to that same thing, is because so we finally got this particular person to get tested, and then where we were going to send him didn't want to test him because he wasn't showing symptoms at the time. So we had to make phone calls back to the doctor to have the test order sent to another site so that we could get him tested that day. So it's a constant advocacy for what we believe is right and just, really.
Good. So just switching back to staff. I know staff, a lot of them are doing the telehealth services and check-ins with the day staff. With the day individuals, and reaching out when we can, and building a technology inventory list, say, for those individuals who need some supports at home so that they can join some of these activities. But I just want to highlight the staff that have worked at the center, those who have come off their first round of the shifts at the center, and then the new ones that have signed on, but also everyone at the residences, that we continue to thank them for their commitment and the services they're providing. We still have adequate supplies of PPE equipment, although we did get word that one supply that we expected to come in today has been delayed a little bit. And so, that makes us a little nervous, because we've heard stories of, Charlie Baker told his stories about his stuff being taken from the Port of New York, and and disappearing, supplies that were originally meant for Massachusetts. And so, you know, we're nervous about that a little bit. We'd rather just see them in our presence and on site, but we don't have those, but we're not at an urgency phase right now. There was a question that came up about masks, who should be wearing masks and who shouldn't be wearing masks. And you know, the Department of Public Health has issued some guidance on that. Sharon, can you just talk about that, the guidance?
On the masks, wearing the masks? Okay, so the guidance is saying that whenever you're outside at all, you should be wearing a mask. They're thinking that it can be transmitted just from your just talking to somebody, and that's another reason to actually make sure that you're maintaining your 6 feet of social isolation. No, geez, I'm sorry. See, now I'm going to screw up here. Social distancing, making sure that you maintain your social distancing. The thought is that there are silent carriers out there because some people are immune, and we're never really going to know a lot of the information that we're finding out because we don't have the testing. So they're just recommending wear the mask. And I would just like to say to you, if you're wearing a mask, that your hands are clean when you put your mask on. Before you take your mask off, you need to wash your hands so that when you're touching your face, that you're not bringing any germs onto your face, because that's the biggest thing. Keeping the mask on is to help you from not touching your hands to your face. And then after you take your mask off, you should wash your hands again so that you know that your hands are clean. So that's 3 times right there, just to take your mask on, put it on, and take it off. Wearing masks out in the for the individuals, what we're doing in the house is if someone spikes a temp or has any symptoms at all, we call the doctor. They're given a mask and they're isolated into their room. They can come out, but they have to keep the mask on whenever they're out in the common areas of the house. The masks.
Right. So
we're providing masks for all the people in the houses, but then we have some staff that don't want to wear them either. Don't want to wear them when they're out in the community either, which we can't force people to wear them when out in the community. That cannot be policed, but it is the suggestion that everyone wear them when they're out in the community as well.
Great, thank you. So I'm going to try to troubleshoot a few of these questions. Greg, I might need your help a little bit in doing it. I can't seem to get them to expand, but I can read them slowly, or you can read them to me. But one of the questions came in about the telehealth services and programming that's happening at home for those individuals that come into our day programs and want to participate in that. And yes, that's available to everyone that attends our day programs, or really anybody. We've had people join in from, if we have one individual live at a particular house and 3 of their other roommates don't live at the house, they've joined the activities as well. We've had a situation to where we did a one-on-one sort of just FaceTime with an individual who needed his parents to help really facilitate the activity and engagement, just so they could hear the friendly voice of the staff that they're used to. And so yeah, we're really trying to troubleshoot those things on a lot of times it's a case-by-case basis, but we do have the regular classes that are happening for those who have their own technology, can get on with limited assistance or just require a little bit of assistance to do it. And so if you want to reach out to your manager or your director of the program where your son or daughter goes, and if you feel like you need help accessing some of these things I've talked about, certainly send me an email or send Greg an email through this webcast, and we will make sure you get pointed to the right direction so that we can get that going for your son or daughter. So the next one's not really a question, but it's a comment about how these unsettling circumstances, how ingenious it was for NuPath to come up with the center to help try to care for the individuals that are living in our programs and best serve the adults with autism, and the way we handled the situation was great. Well, thank you. I think, I paraphrased a little of that. We've received that feedback from a lot of people. We know at the beginning it caused anxiety for many people, but we do think that, there's a difference between quarantining and there's a difference between isolating. And we think that, part of that idea of when you're at your sickest and you're stuck in bed, that you start to feel a little bit better and you're not showing as maybe it's the final 3 days for a person that you're starting to show signs of recovery, that we wanted to be able to give an environment that was more conducive, that allowed them to just, to move around a little bit more, but also following isolation and the quarantining based on what the Board of Health is recommending. And that has been a case-by-case basis. I think it really helped also to not put the roommates of those individuals at risk, because as we know, keeping 6 feet distance and not touching your face and practicing universal precaution all the time is a challenge, and we're all working to have them know the importance of that. But that's a struggle. It's a struggle for us all. We all have seen the things where people have tried to go 2 minutes without touching their face and don't make it. I probably touched my face a few times during this conference, but so Greg, those are the only ones I can see from this end. I don't know if
Yeah, we have some more.
Yeah.
One came in prior, and Sharon, I guess this is for you, and I don't know if you'll actually have the answer to this, because it sounds like it's a moving target a bit, but the question was if NuPath was categorized by Department of Public Health as Category 4, so that NuPath employees are a priority for testing because they work in congregate care facilities with disabled population.
I have to look into that. I just got an email right before this this teleconference, and with some information about that. I know that they have a site in Lowell at CVS that's a drive-through that is, you can go on to that site. Now I can put the link up on our website when we're done here. But I don't think you need to have a doctor's order to get tested there if you qualify. There's a small questionnaire where you live. You have to live in Massachusetts. There's on that website. There's 3 different states that are involved in that type of ability to test people. So I can't answer that, but I'm hoping that that is the case. We've been advocating that for a bit to be considered, since we are providing health care to the most vulnerable population, and we should be considered able to get tested if we feel the need to do so. So I can answer that. I know where that question came from, and I will speak to that person directly, and then we'll also put that answer out there on our website, so everybody has the answer.
Great. Just a couple more. And Dan, I'm not sure, or Dan and Sharon, how to handle this, but we have a parent asking about a specific house, and they want details on a specific house. How would you recommend they request that information?
Can they email directly to myself or Dan, or the 2 of us together, what the questions are, and we can certainly answer to my best of my ability.
Great. The last question was around, well, it is 2, but I think you covered it with the masks, but there was another question about clarifying the CDC change on wearing masks in public before they didn't recommend that, and also about staff and clients wearing gloves.
Staff and clients wearing gloves. Well, that is, we can certainly have people wearing gloves, but it's not really recommended unless you're doing a procedure that needs you to do so, because People forget that they have gloves on and they feel like that's protecting them and they're touching everything. And we don't know that people are washing their hands appropriately. So gloves in the right situation, personal care or, especially personal care. That would be recommended, but in the environment that we have at New Boston Care Center, yeah, gloves are recommended. So it's the situation that the staff are in or the individuals are in, whether they wear gloves. And then also for the individuals, they have to be able to tolerate wearing gloves if it's felt that they need to be wearing gloves. So it's a case-by-case situation. So I guess if that question wanted to be posed to me directly to my email, we could talk a little more to see, if there's any other issues behind the question that they want answered.
Great.
Or
Thank you, Sharon. Dan, the last question was from another parent around job camp and activities, and I don't know if there's a specific protocol or process for parents to make sure that their kids are engaged remotely, if they should be contacting someone directly.
Yeah, certainly if your son or daughter participates in job camp or really any of the programming at NuPath and you haven't received any communication, certainly reach out to your manager or director. We know that they are reaching out, and we have a little sheet that they go over and ask some just health questions first. And we sort of, again, have that sort of in a tiered system so that they'll ask some general health questions. And if one of them creates a level of possible need that the family might have for themselves, caring for a young their young son or daughter, or they're aging in health and need some assistance doing that, it sort of gets bumped up a level to Sharon and her department so that they can follow up on that afterwards and just do a health and safety check and a little more in depth. But also we're asking equipment needs when they're reaching out as well. And so if your son or daughter is or brother or sister are living with you and they're taking part in job camp and they need some assistance in getting into the online classes that have been offered through job camp, then certainly reach out to your direct case manager or your manager that you're familiar with. And if you're not sure, then just follow up with me or let me know that you didn't have any success in doing that. As I was on a call earlier today where we had completed sort of really the second round of check-ins and status checks that we wanted to do, because I think initially some of the first status checks that we had where we were calling into a residential program where we didn't serve the person, at our residential program, we were calling into another house, and in that particular residence, they might have not have been the most helpful in making sure that they helped us get that individual to participate or to talk with us. We've tried to we've asked DDS's help to make sure that houses know that we're going to be calling and that it's a priority that we follow up with them, that it's important that we are able to provide that extra layer of support to them as well as the people that live in our residential homes, because I think that we would want the same for people calling into our individuals, as we've had at a couple of houses where we help the agency facilitate the communication with the individuals that don't come to our day programs but live with us, because we want them to hear from their familiar staff and familiar friends and communicate with them. And so job camp has been up and running for, I think, just over the past 2 weeks. And so please, if you haven't heard from your case manager or manager, reach out to them and they'll be able to facilitate that.
Dan, Brian Ellsworth, I sent that to the entire attendee list. He published his email address, bellsworth@nupathinc.org, for any people attending job camp to reach out to him directly.
Awesome. Thank you, Brian. Thank you. I would have gave that answer right off the bat if I knew it, Greg. So then people wouldn't have to listen to me babble. So I guess I did want to say a couple of things in closing. If there's no more questions, Greg, are we good with questions? I was
You're
able
good.
to. I don't see any more. I will tell you that, as we've gone, we've heard from many families. Thank you for filling out the questionnaires and the feedback sections. That has helped us try to plan a couple of these and try to get different people on to talk about different things. Tuesday ones, like as I mentioned, seem to be a little more of the nitty gritty, the information people are looking for, how we've handled the weekend, how we're planning to handle that next week, number of active cases, all of that. Thursdays have been a little bit of that, but a little more staff heavy. We've tried to engage a lot of staff on Thursdays and really communicate every time through these webinars to staff and families. And we'll continue to do that. And then, Friday is really the outreach group, which Dan tries to think of an activity or get a guest or two to join us. And last week, Rich Hegarty, was able to join us, and he's been a strong advocate for NuPath for ages. And as we have, the COVID relief number 4 package possibly talked about, we'll be tapping into his advocacy again. But so just sort of to let you know, we know it takes, time out of your day. These are available on YouTube later to watch if you're not able to join us during this live conference. And please reach out with questions, and we'll try to point you in the right direction if I'm not able to get the answer to you right off the bat. But we just want everyone to have the same information, to be as accurate and as up to date and honest as we possibly can about every variable that we're trying to factor in and plan for. And some of the questions have been great, and we've tried to get back to those people both online and just by email as well. So, all right. Thank you, everyone. Thank you all very much. We will see you Thursday. Dan should be back at that time. And we will have any update information for you and be able to just give you the latest news that we know. So thank you. Thank you all. Thanks, Greg.